is still trying to get the wheels on all of the things that they want to do. But right now, their success is getting people with criminal records deported. And so, what do we have in Ghana to be able to support these folks coming into Ghana with criminal records? We aren't doing a great job here in our country of taking care of our own criminals. And so, what are we going to be doing with people that we're bringing in? So, I think for many reasons, this is a poor idea. And I think it also doesn't get to what I think was the spearhead behind why Ghana accepted this was to really remove this 3-month visa sanction. I think they want to be in better terms with the US, but I don't think necessarily doing this is the best idea because there will be even worse asks that come. We've seen in South Africa that they're asking them to, in the southern part of Africa, they're asking them to imprison people. Do we have the facilities to be able to do that if that's asked of Ghana? And so I think it was a rash decision that they didn't think through, what could be asked in the future.
Anyone else want to hop in on that? Percy?
Yeah.
Yeah, I see you got off camera. Mute first. Over to you.
Yeah, definitely. I want to piggyback off of what Abna said. I mean, besides the politics of deportation, I definitely think that we need to really think through like human side of that and how she mentioned the resources, because if Ghana has agreed to accept these deportees, then we need to be asking, what is the reintegration plan? Is there mentorship? Is there legal aid? Is there psychological support, especially for these people that are coming in? Because otherwise, deportation is just going to be a double punishment, first in the US and then when they return back home with nothing. So I definitely think that we need to think through like reintegration plans, the resources for these individuals. So I definitely want to second what Abena said.
Yeah, I'd like to come in. I think it's I mean, I agree with what's been said already, but I think there's I think more information that needs to be given so we can understand just how it was a very poor decision that the Ghanaian government made with this, because the issue is, for me, well, I mean, there's a lot of issues, but one of the issues is not even solely just accepting the third country nationals, which comes with, all the issues of, reintegration, ensuring people have access to services and all of that. But what appears to be, or especially sinister in my opinion, is that they weren't just brought to Ghana to stay. They were then sent back to their country, at least some of them, right? And there's a lot of conflicting information. The Ghanaian government said that all of them had been returned to their countries, but now it's come back seeming like only 4 or 5 have been sent. And then now there's 11 that are still remaining. And those 11 are now suing the Ghanaian government. The 5 that were asked to leave are now suing the United States because those 5 in particular had been given essentially special permission to stay in the US because they would have been, there was fear of torture, harm, or even death if they were returned to their countries of heritage, which were Nigeria and the Gambia. And under asylum law, international asylum policies and things, it is, people can be granted asylum if they cannot return to their country, their origin country, because they'll experience harm if they go. And so sometimes third country deportations can happen if people need to be deported, but they can't go back to their country of heritage. But because this current U.S. administration is so pressed to have as many deportations as they can, they are deporting people without due process. And those 5 in particular were denied, especially denied due process, because at least according to the lawsuit, they had the right to remain in the U.S. because of because they would be, there was fear of them being, tortured and harmed if they returned to their country of heritage. So what it appears that Ghanaian government has participated in is called chain or indirect refoulement, which, from my understanding, I'm not a human rights lawyer, but from my understanding of international migration law, is a violation of international law. you cannot, deport someone, have someone be deported to your country and then do the dirty work of the initial country. And that's essentially what it seems like Ghana has done, which is really, really bad, to put it mildly.
And I believe it's actually the Asian Alliance for Justice that is currently now representing those folks who are suing Ghana in courts. So it'd be curious to hear from this group what they think the role that GHPAC could play in this. Of course, those who are suing are not Ghanaians, right? But how could we as diasporans impact this conversation and try to mitigate some of these issues? Do you think that the Ghana government understood all the risk, or felt like coerced to take this role? And should there be some pushback against the Trump administration, I suppose, from the Ghanaian diaspora to say, there's actually a security issue. You're in fact introducing more security risks for Ghana by doing this, and when we need to remain a reliable strategic ally and safe, a partner for the United States. Do you think that that could be an argument that we could, um, push forward?
Who is that to? Is that to anybody?
And to anyone, yes. Because you can disagree with me if you feel that way. But I'm wondering, instead of sort of us sitting on the sidelines, do you think that there's a role we can play? And I see two hands raised, but I'm going to go to the speakers before I go to the hands raised. Good to see you, Ajwa and Melanie.
Especially given the context that you gave at the beginning around Ghana's security situation, I do think that it would be good for those of us in the diaspora and people in Ghana, which to be fair, there's two lawsuits that are going on with these deportees. There's the Asian Alliance group. They are representing the 5 that were sent back to Nigeria and the Gambia, and they shouldn't have been sent back. So they are the ones that have already left Ghana. And then there's the remaining 11 that are still in Ghana, and they are suing Ghana. The other group is suing the U.S. So the people that are suing, the 11 that are suing Ghana, are being represented by a Ghanaian lawyer in the country. So just for clarification, but I do think it's important for us to really, I think, hold Ghana's feet to the fire, especially since when it first came out, the president and other officials were saying that we're doing this in, Pan-African, brotherhood, essentially, when the motives weren't that. It really was to remain, as it was said, to remain in the good graces of the United States. So I think if Ghana truly is the Pan-African Republic that it says that it is, and I think it's important for us, as the diaspora, working with people in Ghana, to ensure that the Ghanaian government does what it's supposed to do in respecting itself and respecting our fellow Pan-African brothers and sisters.
Wonderful. I go to you, Abana. I just want to protocol recognize our last speaker that joined, as well as 2 of our founding council members. But Ivan Che, straight from Ghana, has joined. He will really help to share sort of the perspective from on the ground as we talk about these issues. Ivan, if you can turn your camera on so that we can see you, that would be great. And Ivan is a political analyst. He runs his own TV show. You can catch him on YouTube, where he provides political analysts from Ghana. Ivan, say hello.
Hello.
Good to see you.
Yeah.
And then just recognizing Kimberly Afakwa, founding council member, and Stephanie Arthur, founding council member as well. Okay, Adra Ray, your hand is back down. Are you still here? We'll go to you.
Hi.
Say
My
something.
sister. Yes, I am still here. Oh, did somebody come off mute?
Nope, I think the floor is yours.
Okay, yes, I'm still here. I think we should definitely um run dual tracks and put pressure on the Ghanaian government and also our government, but also the US government here, but recognize that the administration does not care about any of what we care about and what we're saying. So we'll have to, approach it in a way that is clear that this jeopardizes their interest. But even that, I don't think that's going to do as much good. But I think it's our responsibility to say something forcefully about this issue, and I'm happy to support you all in whatever way you decide to do that, whether it's direct meetings, trying to get meetings, whether or not it's a statement or a letter to try to apply pressure.
The closer we get to midterms, the more power we have. We are in battleground states, and the folks need to understand that we are the invisible vote, and stop lumping us in some sort of homogenous vote. But I agree with you, Adwa, that we'll have to make our argument compelling and interesting. Melanie, your hand went back down, but we'd love for you to make your point.
Yeah, hi everyone. I was just gonna kind of echo what Audra was saying. I think it's definitely has to be on both sides, the Ghanaian government and the US government, and then keeping in mind that there isn't really a lot of empathy going on right now when it comes to really, any immigrant population in this country. And I think, and of course, I'm a nurse practitioner, so I always think about my patients, but I have a patient now who's dealing with deportation, and he's been in this country for 40 years. And it's like, I have no idea, where I would even go if I had to go back to, I think he's from Honduras, and, there's a safety issue and all those things. So I think it's what I learned from our great advocacy workshop that we had in March is like telling those compelling stories and telling those, individual people and putting like a voice and a name to the people that they're deporting, because it's just easy to say, oh yeah, just support all the illegal immigrants, they're not supposed to be here. But it's like, what about people like my patient who have been here for 40 years and they're, America is all they've ever known, or someone who may have been brought here as a child, or whatever the case may be. Majority of people don't come here to cause problems, they come here for a better life. And I think that making it more personal through, and GHPAC is awesome at doing that, I think will really help in some way, shape, or form to get to the people who may not necessarily want to hear it. But I feel like just, doing our best to speak loud and advocate for people is the best thing we can do at this time.
Thank you for that. Abana?
Thanks. The other thing that I wanted to mention was US immigration law is purposefully confusing and hard to understand as a mechanism to get people to give up. And I think one of the most powerful tools that we have now is that we have people in our community that are knowledgeable in pretty much everything that's going on, that can do some really in-depth and information sharing. I spent some time in NEMA doing some education around asylum, because folks have a lot of viewpoints about what asylum is. And we know that asylum law says that in order to be eligible, you need to face like sudden death upon return. It's not about country conditions. And so I think there's a lot of misinterpretation of asylum law and like what the US actually has to do and what they have to hold up as a part of this international human rights agreement on the right to asylum. And so I think we need to do some education within our community for our folks to really understand what their rights are. And I think too, we need to do some education around like, what does foreign aid look like? What is it supposed to look like? What are the things that we need to exchange for it? Because I think too, in the same ways that things are hard for people in the diaspora to understand, they're also hard for even our government officials to understand like what they're actually getting themselves into. I don't think if they knew all of the legal ramifications around this, that they would have actually agreed. There's cases where we have folks who seek asylum in Europe prior to reaching the US. And if they're not eligible for asylum in the US, but they were granted asylum, let's say in Greece, Greece tends to accept them because they've already granted them asylum. That's the reason why. And so Ghana should really only be accepting these folks if they have agreed to give these folks asylum in our country and not facilitating the deportation of them to their country of heritage. And so I think we need to do some education both for folks in the diaspora and folks outside to really understand what it is to migrate and what all of this means, because I think there's a lot of misinformation in the news right now. I think the US is purposefully telling the half truths to get people to self-deport so that they don't have to carry the financial brunt of deportation. And in the same ways, like, it's also to stop migration of folks by making things unclear. And so I think one of the things we can do aside from the policy shift is really clear and culturally relevant education for folks within our community as well. And I did want to touch on, there's a question about
the H-1B visa. Yeah.
Yep. I want to touch on the H-1B visa. So I think I'm glad that this came out because a lot of folks are focusing on the fact that this administration is cracking down on quote unquote illegal immigration, and they're really cracking down on immigration as a whole. With the news that came out last night around this with the news that came out last night around the $100,000 request for folks seeking H-1B visas is really what they're really trying to do is kill the H-1B visa program in a really creative way so that there's no legal challenges that as they've been trying to terminate a lot of programs, there's been legal challenges that they faced. And so this is really a way to effectively end the H-1B visa program and to stop skilled workers from being able to come into the US. And I think that, this is truly going to handicap the US in many ways that they don't understand, but this should really tell us that the attack isn't just about people who are in the US without proper documentation or that are under documentation, but it's really to stop folks from coming in and to make this spin that, there's Americans who want to do these jobs, but these foreign folks are coming in and limiting their possibility, their opportunities to hold these jobs. And so I think we're going to see more of this where they're going to attach price tags to certain programs. And we're seeing it right now with you can make $1 million donation to the US if you're an individual, or $2 million if you're a corporation and get a gold card. They're going to add a price tag to make it inaccessible for folks to be able to come to the US, and that the US seeks to gain from this. I mean, we've seen this prior to this administration with the fee increases for USCIS applications and things. And so they're going to find creative ways to limit people through financial means. And again, we're just going to have to think of creative legal strategies to, overtake them, because their plan is, well, yeah, we can add whatever price tag for people to come in, and there's nothing wrong with that, but we're gonna have to get creative on the legal strategy and also pay attention to the ways that we advocate with folks and tell the story. I think for so long, we've told these exceptional stories of immigrants that come in, and we need to just tell the story of, like, we're here to work, whether we're exceptional or not. We deserve to live and work here, because I think it's a function of some of the advocacy that we've done in the past that's really led us to some of these moments that we see today.
I love that. I know that's something Stephanie Arthur, our founding council member, has been saying, that we need to reframe what it is to be an immigrant this country. And I know for those of us who were born in the United States and grew up in the United States, we may not consider ourselves as an immigrant from that sense, but we just have to embrace that term because we have to color in the story for sure. Before I get to you, Adjoa, I do want to say that Ivan, did you, if you wanted to pop in here and just give a sort of a sense of how Ghanaians on the ground in Ghana are reacting to the deportee conversation. We'd love to hear from you on that before we also try to move on to the next topic. Go ahead, Ivan.
All right. Thanks for the opportunity. I think being in Ghana, the conversation is still activated, just like we're having the conversation here. And there is not too much flow of information. People are a bit limited in terms of the information that the government has so far dispatched. So on TV, there are people asking a lot of critical questions. Last week, the Minister of Foreign Affairs came with some statement explaining why the government had to take that particular decision, and the fact that there has been a memorandum of understanding between the Ghanaian government and the US government, which didn't come with any monetary compensation, and other sort of information were given. So the question on the ground has always been, in agreement of this nature, the expectation is that because in 2016, when the Gitmo 2 were brought in, it resulted in a contentious court issue, which resulted in a ruling from the Supreme Court. And the decision was that such an agreement will require parliamentary ratification, which that particular one didn't go through. So in this instance, people were expecting that if there is such a deal between the government of Ghana and the American government, such deal should go to parliament for ratification, but that didn't happen. The explanation was that it was some sort of a memorandum between the two governments. But if you look at the other side of it, I think sometimes what we're doing is governance, and the general public are involved. So whatever it is, the people must be involved in whatever that is happening. And because that communication was not given, that deep explanation was not given, it has resulted in the sort of question that people are asking. We all know America under Donald Trump has adopted a very radical approach in dealing with immigrants, and he's finding every means possible to throw people out. So the question is that if Ghana is accepting these individuals, on what grounds? Is Ghana going to be used as a transit point? And in the individual in question, some were people who are seeking asylum in the United States of America, and people eventually leave their country for the fear of something. They left for America because of certain unbearable conditions that they were dealing with. So the critical question is that if you are deporting these people against their will to come back to Africa, and Ghana is being used as a transit point, then it means at the end of the day, Ghana is going to ship the same individuals back to where they left. And that is a problem. And it's the reason why some of the deportees are finding it quite difficult to accept some of these things. And one of the lawyers is my friend Oliver. I spoke to him yesterday, and he's representing some of them. And I think it's quite a challenge. In my candid opinion, I think the government of Ghana should have considered and look critically at the other side of it, its implications, and other the side of the people of this country, how people are going to perceive this whole thing, because the whole transaction, the whole agreement then appear a bit hazy. There seem to be no clarity, and people seem not to understand what is going on. Because if America really want to put these people out, I think the best thing to do is to negotiate directly with the countries where these individuals come from. But if they are refusing to accept them,
Go ahead.
Yes. So I think the US government could have negotiated directly with these individuals where they come from, rather than dealing with Ghana as a third world, as a middle country. So the question is that if this whole arrangement is not coming with any compensatory package, who is going to finance the transit of these people from Ghana to other states? Virtually, we are going to provide some accommodation for them. Who is going to pay for all these things? And I think some of these arrangements will end up bringing certain cost, which the taxpayer in Ghana will have to bear. And I think it is out of respect that we have to clarify all the critical issues in this particular matter. And for me, even if we are to accept these individuals on the grounds of humanitarian, whatever, it is an opportunity for us to also get something from this whole negotiation. Because if you look at the recent posture of the US government under Trump, if you look at some of his foreign policy decision in recent times, it doesn't favor Africa. We are being treated as some sort of, I don't even know the right word to use to describe the way they perceive us. So I think that our leaders at this point in time must go to the negotiation table from the position of strength to be able to, address some of these unfortunate situation that has been emerging in recent time. Because in recent times, the visa regime in Ghana here was revised. The 5-year visa, which has been given to people, have been revised to 3 months, and no logical explanation has been given to anybody. So I think in situations and instances like this, present a better opportunity for the government of Ghana to engage the US government and seek better terms rather than always allowing ourselves to be used as some sort of a launching pad and whatever foreign policy initiative that people want to put through, get through. For me, I think it's quite inappropriate. And I'm expecting that the conversation going on in Ghana here will get to government, and certain mitigatory efforts will be activated just to ensure that the grievances of Ghanaians are quite addressed. Because as we speak, the lack of information in the system is quite problematic. And now that people are taking legal action against Ghana, at the end of the day, if there is any financial fallout, Ghana is going to bear, because we got ourselves involved in a certain agreement which come with no win for us. And for me, that is quite unfortunate. So I'm expecting that the government will listen to the concerns of the people and moving quickly to address some of these challenges, because we've been here before. In 2016, the Getmo 2.
Ivan, I'm so sorry, but we have to pause here. If you can continue with your perspectives, which has been great so far, as well as Adwa, if you were planning to talk about this, if you can add it to the chat, please. We must try to get to the other topics.
Right.
I see that this deportee issue, we probably should have just had the town hall just on that, because it's and I think we'll consider that for the next one, because clearly it's going to be an ongoing issue, unfortunately. If we could get to this topic of the aid and assistance freezes from the United States, especially because I see there's a number of health professionals in this meeting right now. I want to get you all's thoughts on it. Unfortunately, there were some very loud comments by our own people, not Ghanaians per se, but Africans in general, celebrating the end of USAID. And I have to say that that was picked up on by Secretary Rubio, State Secretary Rubio, and he mentioned it in his memo, I believe it was in July, that Africans don't like USAID, or that we don't see the value and things like that. Now, it's interesting, right? Like, USAID is not just a program for Africa, but he primarily referenced Africans in his memo. So they are listening to us, I guess, when they want to. But this is an issue, because I think what has not been as loud is all of the folks who have or currently or did have projects that were being partially underwritten or covered at home, helping people, right? That were being financed by USAID, or just generally how much of our health infrastructure, hospital equipment, medical supplies, things of that nature are covered by USAID assistance. I'm going to go over to you, Yvonne, for your perspective on this, as to what do you think of the diaspora and its positioning on USAID? Do you think that the diaspora is well aware of how problematic this decision was, or there's the argument that this is needed, this kind of disruption was needed for Ghana and other countries to really build up our own infrastructure, and this is a kick in the pants to do so? What is your perspective on that?
Yes, no, thank you. And thanks for setting the stage in terms of the immediate response that we heard from our colleagues on the continent, and people saying, well, it's about time that Africa invested in its own healthcare infrastructure. Unfortunately, that kind of narrative is problematic for many reasons. One is that in Ghana, for instance, does anyone want to guess how much of our current healthcare spending is or current spending is related to health? How much of our GDP do we spend on health? It's about 3.7%. We don't spend a lot on health, and unfortunately, Ghana and African countries carry a pretty large burden of infectious diseases and other conditions. So that is not the way to do it. overnight. The humane way is not to then cut supplies to life-saving medications. So I'll use PEPFAR as an example. Our colleagues are not aware of the work that PEPFAR has done in Ghana and other African countries. PEPFAR has spent over $23 million in Ghana fighting the HIV epidemic. And even though the prevalence of HIV, for instance, in Ghana is much lower than other African countries, about 1.7%, the prevalence is still high in female sex workers and people who sleep with them, men who have sex with men. Some of us like to pretend they don't exist, they do, right? But these are all issues that we need to address. So the manner in which some of those cuts came about were inhumane. There were people who immediately lacked supply to life-saving medications. So that is problematic, and that's why I'm really grateful that in March, GDNA collaborated with GHPAC, and we're so grateful that GHPAC has these relationships, these connections. And what you guys did, I appreciate, is you first had a training, because for many of us, I've had the experience of being on the Hill, I think about 5 times, but for many Ghanaian people in the diaspora, some of us don't value this privilege of showing up and speaking to your representative. There are a lot of countries where you don't have this privilege, right? And it's actually mind-blowing that you can schedule an appointment, go and talk to them, talk to your representative, share your opinions, and it's very compelling for instance, a Ghanaian physician to show up and say, I worked on the front lines when I lived in Ghana. I live in the US now. I'm an American, and what you're doing has detrimental impacts on health and the well-being of Ghanaians. So that's what we were able to do. And they were surprised that we were there and we were in our numbers. And I encourage more of us to do this, where we engage civically, and Melanie was there. There were people from all over the country. And as Ajwa said earlier, we had about 13 meetings. And many of these elected officials have been to Ghana. They love Ghana, right? And I remember, was it John Jackson? We were in his office and he brought his radio, or he started playing the Ghana national anthem. That was just an amazing moment. All of us were so excited. So for me, the biggest takeaway is us showing up, us being trusted voices, and all of us say that, a lot of African diaspora professionals, we are highly educated. When you talk about degrees, we have them, right? Masters, PhDs. So what do we do with all of that, right? How do we engage more? How do we educate our family members about why it's important to vote, right? Not just vote for the president, but up and down the ballot, why it's important for us to show up. So I'll just say, before I turn it to my other colleagues, which is that this is important. The diaspora should continue to engage. We need to show up, and it has implications for workforce development back home. So for instance, some of you may not have heard of Fogarty. Fogarty is an international research center, and they provide training grants for physicians, nurses in Ghana who want to train as researchers, right? So when that funding goes away, we have fewer resources to train people to conduct research in Ghana. And USAID has done a lot. Just use HIV as an example, but has done a lot to support our governments. Yes, I agree that we need to invest more in our healthcare infrastructure, but there's a process, right? We need time, right? You just don't cut the cord immediately, because there are people who are depending on these, life-saving therapies as well.
Thank you, Dr. Mensah. I have some follow-up questions. I would like to know, and this is not just for you, but for your colleagues that are here to talk about health. What are some of the practical implications of freezing foreign assistance on Ghana's health system, especially clinics, disease prevention programs, training of health professionals, and research? The reason why we ask this question is because you also mentioned that Ghana spends at least 3% of its GDP on health. Given the fact that Ghana spends so little on health in the current situation, how can Ghana best fortify its infrastructure regarding health with the situation that we're currently in Although we do not necessarily, we don't appreciate the cutoff of the immediate health assistance. However, we are in the situation. So what do you propose moving forward, and what can be done? What could Donna do better or best, or what would be a best practice in dealing with the US in this issue?
Yeah, I'll get us started. And like I said, there are other colleagues on the call who are in the healthcare space. I already touched on, health service delivery. And the reality is that about 40 to 50% of our health budget relies on donor funding. That's been the case, right? And you don't switch from 40 to 50% reliance to 100% overnight, right? So there's a process and we need time, but I do agree that our governments need to invest more. So I think that calls for advocacy in Ghana. And this is where I'll look to my colleagues also in Ghana for what are the best ways to advocate, for instance, for the Ministry of Health, right, to invest more and their resources, right? But unfortunately, you think about Kolebu, most of our hospitals and the conditions in which, for instance, women have children. There are people who have children on the floor. I was born at Kolebu almost 40 years ago. I went there this year. Not much has changed, right? So my question now to all of us is, what does advocacy look like to encourage, and maybe encourage is too soft, right? What kind of realistic pressure can we put on our government to spend more on healthcare? So I don't have all the answers, but it's about time so that this will not happen again, so that we don't rely on donor funding. These cuts also have an impact on our healthcare infrastructure, right? So there are projects that are in the process, right? So again, people need time to plan accordingly. And if you suddenly cut on some of these funds, then all of these projects come to a halt. I've already talked about training and capacity building impacts, but just long term. And when we think about disease surveillance, one of the points that we make is that investing in foreign aid is a matter of national security as well, right? The people understanding that, diseases don't respect borders. COVID taught us that. People think, oh, the Ebola is an Africa thing, or no. As soon as there was a potential threat of transmission to the US and other high income countries, then everyone took it seriously. Also Mpox, right? There was a whole task force on Mpox and transmission to the US. And I think it's about time that we rethink how we invest in global health and not be only focused on, okay, US, UK, Ghana, but really think about how we can build a healthcare infrastructure in African countries like Ghana, but make sure that we are investing more locally to monitor the spread of diseases so that if for whatever reason there are cuts in aid, we have the ability to continue to do the work. But I'll stop there, but I know I have other colleagues, Melanie, anyone else in the healthcare space who has something to contribute to this.
Yes, Melanie or any of the other speakers, any additional thoughts here? I see a lot of comments in the chat about perhaps what the private sector can do. So for those who want to weigh in there, as well as, like we said, we continue to advocate and we won't push back against these cuts.
Can I
but-
make a contribution?
Yes,
on this?
go ahead.
Yes, I think healthcare is a very critical sector that we must all pay attention to. When this USAID donor funding support was withdrawn, back in Ghana, I think people were a bit scared about its implications because over the years, it has been very supportive in terms of health service delivery in Africa. But on the second thought, I am with the view that this is some sort of a radical awakening for us in Africa, because in 2023, USAID invested somewhere around $11.6 billion in Africa. This is amount of money. If Africa is really serious, we can mobilize resources and put proper infrastructure and systems in place to be able to take care of our healthcare. Because over the years, if you look at the level of the diseases here, we cannot sit down and wait for donors to come to our rescue. We need to take the bold initiative ourselves, because if you look at other ventures we've been throwing money into, and at the end of the day, nothing comes out of that, we need to make healthcare a priority, because without a healthy population, the economy cannot even survive. So if African leaders begin to make it a priority that, hey, healthcare is the most critical venture, and that we need to pool our resources and make sure we provide all the critical infrastructure that is needed to provide quality healthcare for our people, for me, that will be a starting point. So any donor funding that comes will come as a bonus, but we cannot make donor funding as a primary source of funding. And because of this, other countries over the years have neglected. Not much is spent on health. Like you rightly mentioned, in Ghana, we spend less than 3% of our GDP on health, which is supposed to be more than that. But this particular withdrawal for me is some sort of a rude awakening for us. We need to sit up, take our destiny into our own hands, and make sure that we lead this charge and make sure we provide quality healthcare. In Ghana, for instance, if you look at our...
Ivan, I think you're onto something, but we have a couple of other people that would like to chime in. We have Melanie Owusu, and then we have Sadiq. Did I see that properly? So we'll go to Sadiq Abubakar first, and then Melanie, I believe you're next, and Ivan will circle back around. I apologize for cutting you off. Sadiq? Hello?
Yeah, thank you kindly. I think that first and foremost, thank you all for the opportunity to share. I've heard the talk on the assistance through the USAID and the need for prioritizing healthcare and investing heavily into it. The way forward, one, the reference architecture required for utilizing AI system or AI-assisted healthcare delivery in Ghana exists, and the Ministry of Health is working with an institution, I cannot mention the name for now, that is trying to bring in that reference architecture, set it up, and have low-trained or not specialized doctors to be able to perform surgeries and provide healthcare delivery out of their specialty through AI systems that can assist them, guide them through the process real time. That is ongoing. The other thing I wanted to talk about is the USAID piece of it. Intelligently, the reason why most people were happy that USAID funding was cut is because USAID was also used as an intelligence weapon on most countries. Countries that received the USAID funding, and companies that were used to do those were also source of information for the intelligence world here in the United States, specifically the CIA. So most of why people were happy that it was cut off was because the intelligence component was used to subvert the interest of key countries that the CIA wanted to subvert their progress. So I see there were some things that were positive, yes, but there was a covert side of this conversation that probably this is not the forum for it, but just to mention briefly that this was something that was going on. In terms of what Ghana needs to do and what the diaspora needs to understand to help Ghana is we need to link with the right quarters in government. I know, Ivan, I've seen you with Captain Smart, and your conversations are very positive. I appreciate the way you analyze some of these political nuances. The key to supporting Ghana, this forum is one of the avenues we can use, but we need to liaise with the decision makers in Ghana. It wouldn't hurt if we had a black on this phone to discuss what nuance led to his decision, have him respond to us. We are key to helping Ghana navigate the international relations and key national strategic interests of the United States, because we understand that most of the Ghanaian leadership does not. Some of the things that you think they know, they don't. So we need to find avenues of really pegging ourselves into the decision making and politics or polities of the Ghanaian government, so that we give them the right information and aid them to understand some of the decisions they are making pertaining to key international interests or national interests of other countries that they are working with. I'll end there. Thank you kindly.
Thank you very much. I believe the next person was Abner. Abner, are you around?
I didn't have a question.
Okay, so we'll move forward with Dr. Christy Quarteng. Before I say that, I wanted to say that there has been mention in the notes about venture capital. And I want to kind of redirect this conversation about funding. It was Melanie Owusu. All right, I'm sorry about that. Melanie, Dr. Quarteng, do you mind if I go forward with Melanie because her hand was up first? Okay. So I'll just say this. When we talk about Ghana and investment, certain things, I think that the Ghana government must find a way to use its own GDP and infrastructure to invest in. So it's not at the beck and call of outside influence as it is now, and setting up arrangements that might not be in the best interest of the nation. With that said, we'll move forward with Melanie Owusu. Melanie?
Yes, thank you. Yeah, I agree with what everyone is saying, and I do think that for the long term, it will be helpful for us to have our own sustainable infrastructure to be able to have a healthcare system that can stand on its own without the outside aid. But I think one thing to really note is that, I mean, especially when we look at infectious diseases, look at how, if something happens in one country, it's going to happen around the world. If you look at COVID, I mean, we're 5 years out, but I'm sure it's still very fresh in everyone's mind. One disease that started in China, and that's still debatable. I don't want to get into conspiracy, but something that happened in one corner of the earth was able to spread and shut down the entire world. So I think we wouldn't. Yes, we need to be independent. We need to build our own infrastructure, but it's also that infrastructure has to be sustainable in a way where if something happens in one place, it's only a matter of time. If it's not built well, it's only a matter of time. And even if it's honestly, if it's built well, it can still spread. The world is very small. If things are not set up in a way that is sustainable, it's going to spread and it's going to go everywhere. And I think that's even a talking point for a lot of the leaders in foreign countries who use like giving aid, because a lot of times they are very much worried about themselves in their own country when it comes to certain things. So I think a talking point there is like, hey, if we have a raging infectious disease, whether it's Ebola, COVID, Marburg, whatever it is, and we don't have it under control, and those countries need help and we don't help them, it's only a matter of time before it ends up on our shores. So I think that that's definitely something to be prudent about. And when you take aid away so quickly and don't replace it or don't help to put things there to build it up in a way that's sustainable, you're really putting everyone at a detriment.
I agree with you. I would like to put this out there. People forgot about Ebola. In, I want to say 2014, a little bit prior, there was an issue with Ebola on the western portion of the continent. And Ghana was very proactive about dealing with the Ebola issue, from a national security issue to a health issue, to the health services. And I think that we've the country in some ways may have regressed instead of progressed. And I know that everybody has a thought on this, especially consider where we are now versus where we've been in the past. So I want to put that out there and probably, jog some people's minds, memories, so that, we could think about things in a more independent perspective, whereas aid is essential. We're not sure if it will return. So in the event that it doesn't return, how do we move forward without it? Dr. Quartey, you're up next.
Thank you. I just wanted to say that the aid cuts had a global impact, because I know we see what's happening in the US and people are thinking it's kind of like, the country may or may not be on its last legs, but the US still has a lot of power geopolitically. And so here in the UK, not too long after the USAID cuts happened, UK also did their cuts. Netherlands also did their cuts. Other European countries started following suit. So when we're thinking about what our response as a diaspora should be, to support Ghana, it could be like a global coalition of diaspora, essentially, because our Ghana and other African countries was relying on aid from, mainly from the US. They were the largest contributor, but they were relying on aid from European countries as well. And so, and it's the health sector, the humanitarian sector, all different types of sectors were being supported by Western aid. And so now that this has been removed, there's been a ripple effect geopolitically that is now impacting the continent.
Okay, so with that said, perhaps you may want to think about it in this perspective. Okay, so we understand that we don't have the USAID infrastructure or the infrastructure from abroad that was supporting Ghana's health systems. How can professionals on the ground better collaborate and support the infrastructure that is there to do the needful? And what are some of the risks regarding brain drain at this point because of the lack of infrastructure? Because we already know that a lot of doctors were leaving because the resources weren't there. Do you think that there's a way that these doctors can stay or help to fortify the infrastructure that is non-existent or lack of resource or existent, however, devoid of resources? Another piece about this is what diplomatic tools can we use in terms of diversifying funding resources, bilateral agreements, and diaspora contributions to health partnerships? And the reason why we asked this question this way is another thing that people haven't thought about is there was a point in time where medical organizations were sending machines and resources to the continent and countries like Ghana. I happened to run into a gentleman a long time ago who would get these resources and turn around and resell them to the Ghana government or to a private hospital or entity. And that person would in turn charge the patients there. And so we have a situation where we want to rebuild, but then how do we make sure that the people that need the resources get the resources they need to do their work and be effective? Anyone to comment on? And does anybody want to comment on that?
I was going to, but I see Gimbala has his hand raised, so.
Okay.
Yeah, no, thank you. So first of all, I want to say great conversation so far. As someone that was born in Ghana, grew up here in the US, it's great to be part of this group. Generally speaking, my statement is really more about this collective and the role that this collective can play in this discourse, right? I think there's an opportunity here to create verticals and influence at the regional level, talking to leaders at the regional level to influence up to the central government. Look, from my view, in the US, I think the current administration is overwhelmed with some of the needs and the shortcomings of the prior administration. So they're trying to play catch up, and in ways, there's a couple of mistakes that are happening along the way. But there is an opportunity for this collective to start to influence, at the regional level and build the relationships and and the reputation with some of these regional leaders and work our way up. Ghana politics is fraught. It is almost a zero-sum game. And to get anything done when it comes to infrastructure or anything like that, those conversations, I think, we can start really at the grassroots and regional level more than anything else. And there's an opportunity for us to organize in many different verticals to be able to address individually, whether it is, public health, whether it is in infrastructure investment. There's enough brains and intelligence in this group across the globe that I think if we can organize in that sense and create, a 5-year strategy plan on how we can, engage in these conversations and where we want our investment dollars to go. I've started businesses in Ghana, and I've seen the challenges that comes with that. I think there's great opportunities for us to do that. So that's really what I wanted to say and continue the conversation, and go forward from there. Thank you all.
Okay, Dr. Yvonne Mace. Okay, go ahead. Who?
And sorry, I just want to start by
Okay.
saying I love that. And that is part of the goal of this conversation, is to think about foundational pillars for a strategic plan, both for the US government and for Ghana government. So please put your contact information in the chat or DM us so we can follow up. And anyone else who's interested in helping to build that as well, please let us know. Go ahead.
Yes, and I wanted to point out that someone mentioned countries such as Turkey and Thailand that have created their own infrastructure and systems. And perhaps there might be an opportunity for Ghana to find other partners other than their current partner to do medical infrastructure work to help its residents and citizens. Dr. Yvonne Mesa?
Yes, yeah, just building on the point you just made about New York partnerships. There are people who are thinking creatively about South-to-South collaboration. So the Caribbean, Barbados, Ghana, Brazil, Ghana, right? Not only limiting ourselves to the US, UK, and some of these other countries we've historically partnered with. But in response to your comment about what diaspora healthcare professionals can do, I can speak to our experience with the Ghanaian Diaspora Nursing Alliance. We created this nonprofit 3 years ago, and now we have over 3,600 members all over the world. In fact, our UK country director, Angela Agori, is on the call with us today. They have over 600 members. We hear a lot about, nurses and physicians running away from, Ghana and leaving the country, but we don't talk about the reasons why people leave, right? We shouldn't expect a physician or a nurse to work in an unsafe working environment, work without gloves, sacrifice their lives and their well-being, and work for months and not get paid. So our thinking is that yes, there are people who choose to leave. There are people like me who didn't train as a nurse in Ghana. I trained in the US, but Ghana is still in my DNA. So what we've done is to mobilize all of these nurses, nurse practitioners, people who've amassed all of this education and expertise. And we're saying, what does it look like to sustainably link and advance Ghanaian nurses who are not just in Ghana, but across the diaspora? So we've created this amazing network. And like I said in the chat, shameless plug, in January, we're having a conference, not just for nurses, all healthcare professionals. We're going to have different tracks. We're going to have a track on leadership, innovation, right? What does it look like if you want to promote health and well-being for all, not just for Ghanaians? We'll have people from all over Africa, about 500 attendees. And I'll use just one example quickly. So we want a hackathon where we are training midwives to use point-of-care ultrasound devices in rural areas. Ghana has less than 40 cardiologists. In fact, I think the current estimate is about only 26 cardiologists who are still in the country, right? We train some and we lose them. So you think about Ghana and all the 16 regions and a population of over 30 million, and you only have about 26 cardiologists. What happens, right, when we want to manage the burden of heart disease? So we're looking for ways to train midwives in rural areas to do some of these more advanced tasks and equipping them with tools. So that's how we see our role in terms of what are some of the resources that are out there, what are some of the skills. And we actually had a nurse practitioner from Texas, the training in Ghana with the cardiologist. So that's an example of what ways that, you know, diaspora health professionals, and there are diaspora health professionals who are not Ghanaian, but also are in the healthcare space. So we are welcoming them in this work as well. Thank you.
Okay, thank you very much. So we're going to move on to Angie. And then after Angie, we'll move on to Christy. And then from Christy, we'll move on to Eugenia, and our last person will be Cedric. Cedric, I love you to death, but you've had an opportunity to speak. So the next person we're going to move on to is Angie.
Thank you very much. Hi, everyone. Thank you for the opportunity to speak. I just wanted to give feedback on, the issue about trust and how we can give back without feeling like people are going to steal the items or sell them, or the patients that we're hoping to reach are not reached. I trained and worked in Ghana for 5 years before I moved to the UK. And I did witness firsthand medical devices being sold for patients that are supposed to receive it, to patients that are supposed to receive it for free. I also saw medical supplies that were almost out of date because someone kept them too long, hoping they could sell it, and then realized they couldn't sell it and then brought it to us too late. Okay. And these were very essential items. The first was the LP, it was a sterilized kit for lumbar punctures. And I remember at the time they were selling it to patients for like 50 cedis. This was somewhere in 2012. So I just wanted to say that in GDNA, we do have a wide network of nurses that have been validated and found to be trustworthy. And if we want to create a collaboration where we can empower these nurses and raise them as champions in some of these institutions to safeguard, some of these supplies that we want to be able to reach the patient population, I personally think is very feasible. I mean, I put myself in the shoes of many nurses that are in Ghana now, and I know for a fact that it's not something that I would have done. And I know for a fact that there are nurses on the ground that are very happy to do these things and make sure they do it ethically. I also want to comment that we have had a lot of concerns from the UK diaspora nurses where we've had to, we've tried to raise funds and take it back home. And there's always that concern of, oh, how do we know that the matrons are not going to spend the money? Or how do we know that the medical directors are not going to steal these items? So it is a very legitimate concern. But I believe with partnership with organizations like GDNA, we can really support to make sure that these, devices and equipment and supplies reach the patients that they are supposed to reach. I hope that sort of helps. Thank you.
That helps a lot. Christy, you're up next. Hello?
Me?
Yeah. Are you good to go?
Yeah, I think I said my piece already. I don't
You
have
said your piece already? Okay, Eugenia, do you have anything to say?
Okay, I can add just a little bit. Although I'm not really a health professional, I do enjoy this conversation and hearing the health perspective and how the health systems in Ghana and the diaspora are interlinking. With the freeze of the funding, although it sounds technical, in real life, it also just means that a rural clinic might not have the vaccines for babies, or a nursing school might not be able to train its next cohort. So I definitely think that the diaspora can definitely work on these issues by first, my idea would definitely be partnering up with universities or schools to help to help these hospitals in the US for research and training collaborations. And then also another thing that we can do is just use our voice, go to our representatives and put a face to a story, put a story to a face and humanizing the implications or the, just the problems that come with freezing aid. So yeah, that's really what I just wanted to add.
Thank you very much. Okay, I just want to let everyone know we are already over our time. And we'll be traveling furthermore over our time to 12 o'clock and maybe beyond because we have two more topics to get through. Terry, go ahead, and then Cedric, and then we'll wrap it up because Cedric is on the ground in Ghana and we would like to hear his input based upon everything that people have said. Okay, Terry, over to you.
Okay, thank you all for your time. Just really quickly wanted to chime in because I'm hearing a lot of conversations about collaboration and different ways of working. So just wanted to encourage those who have shared that definitely join GHPAC. The work they're doing is the Lord's work. And, they talk a lot and people get excited, but people don't support them. So I'm calling everyone out who's Ghanaian, who's saying they want to learn more, that make the time. We know life gets in the way. You have families. You have family in Ghana. You have a job. Then you have all these things you need to do, church, whatever. But I'm asking you to please get involved. And that's how I started, right? I would join these conversations, learn, but I don't like politics, right? And I know it turns people off because this is political, but politics is your life. It literally informs where your kids go to school, what your healthcare looks like, right? And so I just wanted to say that piece that please, please, please definitely support the work that these amazing folks are doing. Again, they have access to the halls of power. Nana Ado, Muhammad, they're going to come and go, right? And once they leave, they may not have the same power that GHPAC will always have, where they get the direct calls from the people on the United States side who make these decisions that affect our families in Ghana. So if you're MPP, NDC, PPP, it doesn't really matter. Please support GHPAC because it literally makes a difference. And so they need support. I know Adjua sometimes may not, be as vocal as saying it. So I just wanted to take my time to just implore you all to please support the work that they do. Thank you.
Thank you very much, Terry. Okay, and to wrap this topic up, we're going to move on to public-private partnership and infrastructure and policy. So before we do that, Cedric, can you please help shed some light since you are on the ground right now? Cedric? Going once? Going twice? Okay, it appears that Cedric is not available. So it appears that Cedric is not available, so we're moving on to our next topic. Our next topic. Beyond remittance, how can the diaspora invest in Ghana long-term development, business, skills transfer, social entrepreneurship, creative industries, policy framework, or institutional mechanisms to support the diaspora's investments in terms of banking, double taxation, diaspora bonds, public-private partnerships, and the like. So who wants to take a stab at that? I believe that would be Ivan? Ivan? Ivan, are you with us? Hello?
I believe Kirsty could also weigh in as well as Eugenia. I know that they're all working on projects related
Okay.
to public-private. Yes.
Oh, whoa, Cedric is back.
Okay.
Okay. Before we jump into that, Cedric, did you hear what we said earlier about you wrapping up?
When you say Cedric, is it the Siddiq Abubakar or someone else?
Siddiq Abubakar.
My apologies. I heard you mention the name, but I couldn't relate. I apologize.
I apologize.
No worries. I wanted to say two things. one, within the framework of the
Hello?
hello,
Yeah,
can you hear me?
yeah, your internet, you went out on us.
Okay. Is it any better now?
Yes, it's a lot better.
Okay, thank you kindly. I was saying that within the current status quo or international order, it's going to be very difficult for Ghana or any other African country or developing country to navigate because you are working within the framework of a certain financial institution that was not designed first and foremost to benefit you. It was designed to benefit those who designed it. So as we're talking moving forward, we need to begin to think outside the box of how to help our motherland to navigate on its own, establishing its own new model. And this is why sometimes when you talk about aid and how it infuses itself into supporting us or making us lazy in internally looking at how we generate resources from within to build our own aid in the United States, who
Okay. So, Sadiq, you're going out again. We're going to have to move on. But we would encourage you to note some of your comments in the sidebar, in the side chat, and we'll move forward. Back to our next topic. So we're talking this time about
for the continent or Ghana.
So we're talking this time about.
So we're talking about diaspora investment in public-private partnerships. There was a lot of comments in the chat about it.
Yes.
Yeah.
This is where we fit in. This is where we fit in. Should we advise Ghana to maintain the Bretton Woods structure of finance? No. Should be currency bills to deal with when it's not having the machines to back these currencies? No. Ghana needs to revert into what is best for itself.
Sadiq.
The interest.
Hey, Sadiq, I'm
Can you
so
hear me?
sorry. No, we cannot hear you.
Cannot hear you.
Can you put your comments in the chat? And Kirsty, can you jump in, please?
Yeah.
I know you've mentioned some projects you've been part of. You have a mission trip coming up. Some of these issues, as we talk about investment, given right now the focus because of the Trump administration on more transactional investments in terms of critical mining and minerals, but previously in the past, investment and public-private partnerships also help to fuel sustainable development. So how can we, in your view as a diaspora, push, and it was mentioned earlier about, the opportunity on a regional level, but how can we as a diaspora push for public-private partnership investment that really still continues to support sustainable development in your view?
Well, for me, my first answer will always be trust, and building trust both. And I think it's a bit tricky at the moment because we do not, I wouldn't say our communities necessarily trust the U.S. government at the moment. And then trusting the Ghanaian government is something that diasporans haven't been we haven't really we haven't really done either. So I think right now it's going to take a lot of creativity, and I also think it will um, take relying on our members of Congress that we do trust. People like you said, Gabe Amo. I know there was I believe she's a Haitian American woman based out of Florida. I can't remember her name right now, but she proposed pardon? Pardon?
Congresswoman Sheila Shref, Congress.
Yeah, so essentially using the people in our government that we do trust to work together with them to create the private public partnerships that we need to create, you know, job creation, economic development on the continent. But then of course there can also be like organizations like GPAC. I know Terry, who spoke earlier, he's doing a lot of great work with Black Band. There are a lot of different organizations that are taking things kind of on a grassroots level and mobilizing people to create different partnerships, different opportunities for investment direct into the continent. And for those of you that might not have heard earlier, but I'm currently working with the African Foundation for Development, which is a UK-based organization. They were started in 1994. And they do a lot of different work in the Africans, diaspora, and development space. They work in policy, and they've also done quite a bit in diaspora finance. They have, I think, since 2016, they've done a lot of work with African diaspora communities throughout Europe, but mainly in the UK, and in getting connecting diaspora investors and entrepreneurs, encouraging them to invest into SME, small to medium enterprises in Benin, in Nigeria, I believe Sierra Leone, and in Ghana. And I believe they have about 500,000 pounds in like matched investments, and they've created about 1,000 jobs in different countries all over the continent. So they are not new to this. They are definitely true to this. And so it's with them. And if I can also do a bit of a shameless shameless plug, in November, for those of you that missed earlier, we will be running a diaspora trade and investment mission to Ghana. If you are looking for a concrete way to invest into the continent, if you're an investor, you're an entrepreneur, or you have the desire to invest, I would really encourage you to consider coming on the mission. We are doing this in partnership with the All-Party Parliamentary Group for Ghana, which, like I said earlier, is like a kind of like the Congressional Ghanaian Caucus, but for the UK Parliament. And the APPG for Ghana is currently chaired by Belle Ribeiro Addy, who herself is a British Ghanaian, and she is the former UK trade envoy to Ghana. And the areas that we are looking at are heritage and tourism, agriculture, and property and real estate. And I know, like at the surface, those sound kind of disjointed, but everything is really interconnected, especially thinking right now, year of return, beyond the return of the Black Star experience. Tourism heritage, that's the way that a lot of people are coming in. And as they are coming to Ghana, they're getting interested in Ghana. They want places to live. It's real estate, but then also there's a lot of conversations about people living in Accra, especially, but in other places around Ghana being pushed out because of all the money coming in. So people are wondering, well, okay, where does the average Ghanaian where can they live? That's something that we will be exploring as well, especially specifically around student accommodation, because that is something that is a very significant issue. And then, of course, agriculture, the food that we eat, the land that we build the houses on, Galamsey is really impacting all of that, right? So it's important for us to be involved in practical, tangible ways. I know I'm going on, I'm almost finished, but the SMEs that we'll be working with are, like I said, trust. These are vetted SMEs. Ford has been on the ground, like I said, 30 years. They have a lot of partnerships with different government, they themselves have a lot of private public partnership experience working with the government, working with local organizations. And so it's through them that we are locating trusted SMEs in these sectors. So if you are interested, we'll be having an online information session on Tuesday. If you want to learn more, I can drop the links in the chat again. You can also send me a message on here directly. I can give you more information. If you are in London, I heard Miss Angie, Nurse Angie, I believe you're on here. If you're still on here, we're also having an in-person information session on Thursday. So yes, please join. As Abena said, that our community, we have everything we need. Africa really has everything that it needs on the continent and in the diaspora. So please be a part of what's going on. Put your, quite literally, if you can, put your money where your mouth is and support us in our efforts. Thank you.
Thank you for that. I do want to pop in before we continue, Inez, to say that it's so wonderful to see that our UK are doing all this. But even in this environment here in the United States, there's opportunity to do the same. Congresswoman Sheila Sherfilis McCormick out of Florida, along with Congressman Jonathan Jackson, who we mentioned before, we have a great relationship with, did introduce the Africa Diaspora Investment Act. GHPAC will be whipping votes on this, meaning we'll be on the Hill getting more members of Congress to endorse it. So if you're interested in being part of that process, let us know. It does include a repeal of the remittance tax. If you're not aware, the federal remittance tax was placed on us, really targeting cash transfers in particular at 1%. GHPAC was part of the pushback when it was originally proposed at 5%. But we are not satisfied. We want this to be repealed completely, because this kind of tax impacts our African markets that rely on that traffic, that foot traffic that comes in to do cash transfers. And this is also very classist. And, the thing is, you're worried about advocacy in this environment, but a lot of African business owners or market owners are part of the local chambers of commerce. And local chambers of commerce donate, okay, and are very important to Republicans, for example. And so this is where we have to mobilize our business owners to push back against this remittance tax. We also want to see an expansion of this bill to support, financing at the state and local levels as well, so that we're not completely beholden to the DFC, the International Development Finance Corporation, of which has been a lot of issues with Ghana and the DFC. So we want to see that, like you just saw Governor Newsom come out and say that California has one of the largest economies in the world. States have big economies, and they have industry interests that we can align with industry interests in Ghana. So if you're interested in any of that work, please let us know, and we will do that, as well as and just quite lastly on like real estate, just FYI, GHPAC is very much interested in expanding affordable housing in Ghana, and we are also collaborating with ABSA Bank, and we will have an event with ABSA Bank in I believe October. So just stay tuned for that. All right, Inez, over to you. I think we can go to community priorities to sort of close up, unless someone else had their hand raised, or if Eugenia, you wanted to hop in here regarding projects you're aware of. When we're talking about public-private partnerships or investment, then we can go to community priorities.
No, I think I would just chime in by just reiterating what everyone has been saying. Definitely getting involved with GHPAC and everything that they're doing, because I definitely think that GHPAC is like the umbrella and the head of what's happening and connecting the diaspora to different investment opportunities. So definitely stay in touch. Definitely add yourself to the WhatsApp. Don't take yourself out. So that's what I can add on the diaspora engagement.
Okay, Ina, over to you on community priorities as we think about what should we prioritize with all these issues we've been talking about regarding a framework for the U.S. government and Ghana government. Over to you, Ines.
Okay, I think that when we talk about the U.S. government and priorities, I think that we need to collectively discuss our direct priorities. And what I mean by that, as a community, we need to step outside of whether it's a lot of times we're bound by our faith and belief systems in that way. And I think that we need to stack those belief systems up versus the need and the actuality of the situation that we're in and what means based on survival and sustainability. And so one of the things I think that Ghanaians have done in the US, we've sustained well in terms of education and economic situations, but I think that socially we're not as interconnected as we could be. And that also helps us when we advocate for our own community here in the US. And I'm curious to hear what you guys think and what some thoughts are in terms of how we pull these resources, these academic, financial, maybe creative economy resources, and put them together and drive the needle forward in terms of our relationship in Ghana and abroad. Terry.
I just want to say, for all those who mentioned the different groups, the Ghana physicians, shout out to Kwesi, the president, my guy, the nurses, the lawyers. What if we do a convening of all these bodies, right? They're existing, working in silos, doing the work. But what would it look like to, even if it's next year, you don't have to do it this year, next year, December, Ghana, something, UK, US, like the organizations are there, but do they know what is happening? So if I'm like a doctor, I work with doctors, I advise doctors. Doctors don't really know business. And it's not a shade, it's just what it is. Imagine these doctors talking to lawyers, talking to nurses, talking to financial professionals who care about Ghana and say, okay, these are your priorities. Okay, let me do this. And then you have GHPAC as the umbrella that coordinates, right? Because again, these folks, GHPAC, I'm going to say this and I have to go. I've seen them change policies that affect you reading this, listening to this here in the US and your families in Ghana, right? And they've been asking for support for so long. So I'm just really excited. And maybe that's why I keep saying this, because this is a real chance. A lot of you've heard all the talk all your life from the Ghanaian politicians, and it's no shade to them, but like I think Sadiq had said, they're controlled by Bretton Woods finance, so they don't really have power. The people on this call get the calls from the people who tell them what to do when they're in power. So who would you rather work with? The person who's going to come into power every 4 years, 8 years, or the people who literally get the calls from the people who make the decisions right now, IMF funding? Who do you think they're going to call? They're not calling Nanado. But the people on this call, GHPAC, can influence these decisions. And they're asking you, what do you think on this call? So I'm just saying that to say, idea number one, if we could convene all these different bodies at some level. And then number two, again, please support them. They shared the WhatsApp group. Whoever's controlling the WhatsApp link, drop it again. You get a chance to speak your ideas, right? And actually be heard. And that's all many of you really want. And so, as you've heard them say, the remittance bill, it was 5%. This is the United States government. This is not Ghana government. But because of the people on this call, in addition to others, it was reduced. What else is possible? You understand? Especially if you run a business, you're looking for money. They have access to DC to get you money. You understand? So I know we tend to work in silos. I'm speaking to myself. We do things on our own. We think, oh, I can do it. You really can't. So let's work together. Let's actually embody the spirit of collective wisdom. All right. So thank you all for your time. Ajwa and Cole, God bless you all. Thank you, because this is really, really life-changing and game-changing as well. All right, peace.
Hey, Pastor Terry, thank you so much for that. I also just want to honestly just thank the speakers too on this call. We are, gonna do things last minute. We're always calling on folks. Hey, can you jump on a call? Can you speak at this, whatever? And I'm just so blessed to say that these folks, these speakers, are always up for it, and we really appreciate these partnerships and everybody's time. I see a lot of folks in the chat. If you need us to post the link again regarding how to join our WhatsApp group or how to become a member, we'll post it again right now before we wrap up. So just say, hey, repost, and we'll do that right now. Uh, Inez, should we wrap any other questions that we should get to? Does anyone else have anything that we did not touch on today that we should have discussed? You can raise your hand right now as we open the floor in these last 5 minutes or so. Go ahead, Abna.
Well, there's just one last thing that I wanted to touch on, which is the embassy in the US, the Ghanaian embassy specifically. Um, there's obviously a responsibility to issue visas to folks who are traveling to Ghana and need visas. Yes. And the second thing that the embassy has a responsibility is issuing of travel documents to folks who are being deported. Um, I think we talked about like some ways that we can influence. I think those of us in the legal field can work hand in hand with the embassy to ensure that the folks that they're issuing travel documents for are people that actually should be getting them, because this isn't something that just started with this administration where they just issue any travel documents for anybody. The US government is crafty in that when they want you gone, they want you gone. They will get any country to get you travel documents and send you there. And once you're there, you kind of have to deal with whatever the ramifications of those things are. And so I think we also need to be in touch with the embassy and make them aware of what's going on and what due process people have. One of the challenges for Black immigrants is because a lot of the free legal services within the detention system are often tailored to those who are Spanish speaking. A lot of our folks end up getting wrapped up and just moved through the system silently. And so if our outreach should not just be for people who are out on the streets, but also people who are in detention and ensuring that they get their fair day in court, and that they're not just being rushed through the deportation machine because our embassy is just issuing a travel document because they're being asked to, but that they're asking the critical questions. They have these diplomatic relationships that allow them to be able to ask these critical questions. So if folks here have relationships with the embassy, with the new leadership, that was just brought in, I think these are some things that we need to be tackling right now to ensure that we're being watchful of what's happening there.
Yeah, so GHPAC will be conducting outreach to the new ambassador. He is if you haven't heard that news, there is now a new Ghana ambassador to the United States. Coming in a little late, to be honest, but still critical nonetheless. And his name is Victor Smith. He is the brother of our previous ambassador under the first Bahama administration. GHPAC, we enjoyed a great relationship with his brother, the previous ambassador. So we're hoping that we can have a continued great relationship with the new one. But yeah, there are a lot of concerns about the embassy right now and the consulate, especially also if you haven't heard, they have now Ghana has restricted the honorary consulates from helping process visas. This is a huge blow. Just sort of the end of the previous ambassador's term and the previous administration's term, they had finally picked 5, I think it was, honorary consulates. So one in Atlanta, Yvonne, who everyone knows is a pillar in the community. One in Texas, Mr. Achapong. One, I think, in Worcester, again, another pillar of the community there. They picked recognizable faces to be honorary consulates. But for whatever reason, they have recently restricted their ability to process visas or help with the visa process. So, we're going to inquire about that. I don't know if they just need to do their own vetting or not, but I think the Ghanaian community will agree that we need more capacity with our embassy and with our consulate, like in New York as well. And so this is really a problem if we have these sort of restrictions in place, especially ahead of the holiday season. Anyone else want to comment on that before we wrap?
Eugene Taiwa said something in the chat. He's saying that this thing, can we just move it to Visa upon arrival and go digital? So I guess that's something that GHPAC can make a recommendation for.
Andrew and I were literally just talking about that the other day, that it's so unnecessary, the process that folks go through. And even we say we have visa on arrival, but then in order to get the visa on arrival, they need to send okay to board to the airline. They just honestly make the whole process very complicated. And if we're trying to welcome people to invest or come to, for the first time, these small processes can really deter people from even wanting to continue the journey.
Very true. There needs to be more transparency right now, depending on who you talk to. That cost somehow changes to get your visa or get an emergency visa. It's very, very complicated. I think the government will point to budget and they will say, oh, you know, to implement a digital infrastructure will cost this and that. Obviously, some will disagree about whether or not Ghana government has enough money to invest in something like that. But I think if we're going to continue, especially with Mahama recently rolling out the Black Star experience, which is supposed to replace the Beyond the Return regarding tourism, but also just a few days ago, they launched the Road to the Diaspora Summit. So apparently there will be a Diaspora Summit in January, I believe. We will certainly invite the Diaspora Affairs Director, KOD, to address GHPAC very, very soon to share more about these plans. But I think one of the things that we can certainly put in this strategic framework is around visa processing and what we all recommend, particularly to just have more transparency, accountability, and ease is really an important issue. I see Sadiq, your hand is raised.
Yeah, thank you kindly. Just wanted to say two things again. One, I apologize for the in and out. I was going through an area that has restricted network, so I kind of fell out. But in terms of the issue with the embassies, we should be very clear. The pull from the government was because there was a very huge fraudulent system that was working in the background, where a party affiliated entity was hired to route visas from the embassy to their office, and they would package the visas and send them to people who had applied for them. Sometimes when you apply for a visa and your passport was in their office, all they had to do was take the return envelope that you provided and then insert your visa into the envelope and drop it at a courier service like FedEx or DHL, which is what you have already paid for, to return it to you. But they were charging you extra for that process when the embassy had the staff to just finish your visa, insert it in the return envelope you provided, and then FedEx and DHL or whichever courier you signed with comes to pick the mail from the embassy. That was the process. We added another layer and we're charging the visa applicants extra just to pay a party affiliated person to make him rich so that he can come back and then support the party. That was wrong. And the whole visa application process with the portal was also corrupted because there was a lot of money paid to the one who was actually the IT person at the embassy. So the government had to pull up because there was a big scandal that came up. Aside of that, I think the other thing when we're talking about the diaspora partnership and health and all of that, I don't know if I had someone mention Project Cure, but I am working with Project Cure, and what we are agreeing to do, they would provide the hospital equipment, and this is a government partnership. So government is going to actually pay Project Cure to acquire specialized equipment and take it from the manufacturer straight to the facility that requires it through government quarters. So there's no third party that can take the equipment and then sell. And for GHPAC, what we probably can also do is to actually go into partnership with Project Cure, or there are institutions that liaise with equipment manufacturers, medical equipment manufacturers, that out of the surplus of production are unable to sell. And if you can do a fundraiser that raises about $25,000 and you work with them, they would staff a 40-footer container full of medical equipment worth probably millions of dollars from the manufacturers straight to the hospitals you want to donate it to. So there's no middle person but you. If there is no accountability, it's because we did not do due diligence. But these are avenues that we can utilize to support Ghana. Thank you kindly.
Thank you, Sadiq.
If you haven't already, please share your contact information. And yes, I can say that GHPAC would be very interested in collaborating and working with Project Cure, and helping with fundraising efforts as well. So please share your contacts. And thanks for, obviously the controversy, there's been the controversy with the contracting out. I think from GHPAC's perspective, it would be great to just generally see more funds and capacity provided to the embassy, because this issue of processing visas has been long-standing, no matter who has been in office, and it looks like to continue to be a budget issue, where there is just not enough capacity at the embassy to do it at a faster pace. I can't tell you how many folks have called GHPAC to help with processing visas, because or navigating the system or making phone calls, and it shouldn't be like that. So I think that's definitely an issue that needs to be raised. Is there anything else? If not, I do want to thank everyone for joining us today. I hope that you all have left your contact information. We will have another town hall soon. The suggestion that Terry made regarding getting our leaders together, we have excellent relations. GHPAC has excellent relations with the Ghana Physicians Organization, Nursing Organization, Lawyers Organization, Ghanaian Engineer, the Ghanaian associations, in the different states. And so we will do a leadership call with them as well and at that one, we would like to then have somewhat of a sketch, an outline of the framework based off of today's conversation to present and to look at, to get feedback on. So that will be a step. And then we will also have a gathering of Ghanaians in government affairs. So for those of you who are listening and you are in government affairs of some kind at any level, we will have a gathering of those folks as well, just about how we can collectively utilize our leverage and influence to get things done. Okay, has everyone shared their contact information before we end this Zoom? Okay. All right. Please do before you leave. Again, we want to thank you guys so much. I want to thank Kirsty, Eugenia, Dr. Yvonne, Abena and Ivan, if you all want to say a few, just 1 minute lightning round, one message or call to action based off of the conversation today that you would like us to prioritize as a community. If you can all leave us with 1 minute of a call to action as folks leave their contact information in the chat. I will start with Dr. Kirsty.
Join GHPAC, stay informed, know your rights. Follow Badgie, follow GHPAC, follow me on Instagram, know your rights in this era, and sign up for the Diaspora Trade and Investment Mission. It is, we're running it from the UK, but it's open to any African diaspora person anywhere. Where your money, where your mouth is, we need to invest. Thanks.
Thank you, Abena. Abena? Okay, we'll come back to you. Eugenia?
Yes, I just want to say thank you for having me here. I definitely think that diaspora engagement starts with trust, education, and also please do continue to stay in touch with GHPAC. You can also follow me as well. I'm a youth who's really involved in the African community, UN entities and everything like that, and international affairs. So definitely let's stay in touch and let's continue to have our youth at the table. So anywhere where I can join and I can help with policies and having the youth come out to like the Hill or anything and be advocates for different policies, I'm definitely interested in that. So let's definitely stay connected.
I guess I'll go next. And again, thanks to GHPAC for the opportunity to be part of this conversation. So yes, join GHPAC and also join GDNA if you're in the healthcare space. I know many of us know a lot of nurses, nurse practitioners in our networks. I put the link in the chat. Please share the link with them. We're continuing to grow our membership to do more impactful work. Thank you.
Abena's back.
Hi, sorry, I had to take a quick bio break. Thank you all so much. This was a very great panel. I learned so much, and I'm looking forward to engaging with all of you in the work that we do at GHPAC.
Great. Abena, do we have your information? So if somebody on this town hall needs your services or needs to link someone with your services, they can reach out to you.
Yeah.
It's in the chat.
All right, and then Ivan? Is Ivan still there? Any last words?
Ivan?
Okay, he might not be there.
All right, well, are we signing off? Angela?
We are. Thank you guys so much. Please stay tuned. We have a ton of updates. Like I said, more town hall conversations, activities in December. We have activities this week. If you're in New York, we'll be at Ghana House on Monday at Impact Hub. And Wednesday is the reception for Congressman Gabe Amo, one of our own, serving in the United States Congress. He's the vice chair of the Foreign Relations Committee, and has a lot of power to do things. And Thursday, One Voice Africa reception, also in DC. And then, we'll chat soon.
Thank you, everyone, for coming.
Thank you. This has been great. Thank you so much.
Okay.